Hello, this is a presentation over postpartum depression. Our group is on Fridays with Sarah Burkhead and includes Leslie, Alyssa, Allison, Ashlyn, Renee, Amina, Megan, and Relisha.
In this presentation, we will address the pathophysiology, manifestations, prognosis, and treatments for postpartum depression. To start off, we will be talking about the pathophysiology behind postpartum depression. As an overview, postpartum depression is a more severe and long-lasting form of depression that is developed after the birth of a child. It can be shown in both parents. This means that it can have a long-lasting effect on all members of the family. Fathers who have had a prior history of depression and who are struggling at relationship problems are at a higher risk than those who are not. This condition will end up affecting about 1 in every 7 new parents. Not only that, but if there has been an incident of postpartum depression in a previous pregnancy, the chance of developing it in a following pregnancy increases by up to 30%. Postpartum depression is most caused within 6 weeks of childbirth, but can be developed at any point within the postpartum stage. According to an article over postpartum depression, as many as 75% of people experience baby blues after delivery. Up to 15% of these people will develop postpartum depression. 1 in every 1,000 people develop postpartum psychosis. Baby blues is considered a less severe sadness that happens postpartum but does not persist and will eventually clear up. As previously mentioned, postpartum depression can lead to cases of postpartum psychosis for every 1 in 1,000 patients. Postpartum psychosis is an extremely severe form of postpartum depression which requires emergency medical attention if suspected. Symptoms of postpartum psychosis can include severe agitation, confusion, feelings of helplessness and shame, insomnia, paranoia, delusions, hallucinations, hyperactivity, rapid speech, or mania. Postpartum psychosis leads to an increased risk of suicide in the mother and harm to the baby. Experts don't quite understand why postpartum psychosis occurs, but suspect it involves a combination of factors which include history of previous pregnancies, family history, postpartum hormone changes, or previous history of other mental health conditions. There's a variety of treatment options, which can include medications, hospitalizations, and psychotherapies in order to recover to an adequate state to care for self and for the safety of the child. On this next slide, we have a graphic that shows the statistics of postpartum depression from Brown Med Peds residency. Up to 1 in 5 women will suffer from a maternal mental health disorder like postpartum depression, and less than 15% of women actually receive treatment. As we previously talked about, 1 in 7 will experience depression during pregnancy. Up to 50% of women living in poverty will suffer from a maternal mental health disorder. Not just moms are affected by postpartum depression. Maternal mental health disorders impact the whole family. More than 600,000 women will suffer from maternal mental health disorders in the U.S. every year. Anxiety and depression have risen 37% in teen girls. This will, in return, increase the number of women suffering postpartum depression in the future. Rates of depression are more than doubled in Black moms due to cumulative effects of stress called weathering.
Next, we will be talking about how hormone alterations play a role in the development of postpartum depression. Hormone alterations can be due to the changes in the biological and endocrine systems. During pregnancy, the release of hormones will increase and remain elevated for up to 12 weeks after childbirth. This increases the risk for postpartum depression. One class of hormones to discuss includes a hypothalamic pituitary adrenal axis. According to an article written by Siddiqui, this hormone causes the release of cortisol during trauma and stress. If it is not normal, the response decreases the release of catecholamines, which leads to poor stress response. Next, estradiol and progesterone both play a role in the development of postpartum depression. Rapid changes of these two hormones can become a stressor and lead to an onset of depressive symptoms, which can begin to spiral if not treated promptly. Finally, The last two hormones to discuss are oxytocin and prolactin. Both of these hormones aid in the synthesization of breast milk. It has been proven that failure to lactate can lead to the onset of postpartum depression due to mothers feeling inadequate to properly provide for their newborn. Lastly, thyroid levels can also be a factor in postpartum depression. The thyroid is a gland in your neck that helps you produce and release certain hormones. Many studies have shown that low levels of thyroid hormones can oftentimes lead to postpartum depression, but the reason is currently unknown. Along with hormones, though, genetics can also influence postpartum depression. As we all know, genes store instructions for the way your body grows and works. Genes are also passed from parents to their children. Therefore, if an individual has a family member with a prior history of postpartum depression, they are more susceptible to being diagnosed with it as well.
Lastly, it is important to know when to contact a provider. You should contact a provider if symptoms seem to worsen, if symptoms do not seem to subside after 2 weeks, if caring for the infant becomes challenging, if it becomes difficult to complete everyday tasks, if you have thoughts of harming self, infant, or others, or if you experience any sort of suicidal thoughts.
On this next slide, we're going to talk about the prognosis of postpartum depression. Postpartum depression is experienced by approximately 8% to 20% of women during the postpartum period, and is likely to occur around 4 weeks after birth. When postpartum depression is detected early, it is highly treatable. Early detection and intervention are crucial to improving the prognosis. It can frequently recur, and up to 70% of women with a history of postpartum depression will have a subsequent episode. Women with a history of postpartum depression who are currently experiencing the baby blue have a very high risk of developing major depression. The prognosis of postpartum depression is generally good with appropriate treatment. Treatment options for postpartum depression include therapy, medication, and support group. Therapies such as cognitive behavioral therapy and interpersonal therapy can help mothers understand and cope with their feelings and improve their relationship with their babies. A combination of therapy and medication is the most effective treatment for postpartum depression.
According to Healthline, postpartum depression usually goes away during the months after delivery. Some women have symptoms for months or years. With the help of appropriate treatment, the prognosis of postpartum depression is usually quite good. Better outcomes will require long-term use of therapies, including psychotherapy or talk therapy, and even cognitive behavior therapy. Medications like antidepressants, called SSRIs, can also help. Sometimes hospitalization in severe cases of hallucinations, suicidal thoughts, and even thoughts of harming baby. Symptoms may last for months or years. If left untreated, illnesses can cause prolonged misery for the mother and can even hurt the mother and baby relationship. Managing symptoms are the goal for postpartum depression. Um, they are at risk for poor diet and low compliance with medical recommendations. And then they also become the victim of emotional, physical, or sexual abuse. Appropriate treatment may help lessen postpartum depression. And those treatments include the therapies, medications, and sometimes hospitalizations. Although postpartum depression can be temporary, it can also have long term effects. Treatment does not always make depression go away completely, but it would help with the depression. Women who suffered um, postpartum depression are sometimes likely to experience it again. Um, the likelihood of postpartum depression coming back in non childbirth episodes is about 25%. The likelihood of postpartum depression coming back as postpartum depression is 40%. And a reoccurrence of depression that a woman most likely will suffer is about 24%.
Postpartum depression is one of the most common things that goes unlooked at in moms after labor. Some of the manifestations are crying, recurring headaches, restlessness, insomnia, and irritability towards your partner, family members, or friends. Extreme fatigue is often seen. This can be from a loss of appetite, which can cause weight loss, or it can be the opposite effect, which is appetite that increases that can lead to weight gain. We see both of these in mothers with postpartum depression. A lack of focus and concentration is often seen in the mother. If she does go back to work, she has trouble focusing and her concentration is very low. She'll repeatedly go over thoughts in her head, like constant rethinking things, analyzing situations. This can be a reason why moms often have trouble sleeping and have insomnia. Depression signs often are similar to postpartum depression, such as feeling of hopelessness, anger, anxiety, guilt, sadness, and mood swings. Moms who feel this way after labor often feel guilty for feeling this way when they shouldn't. Mental health among moms and everyone is often overlooked, so it's important that we look out for these signs and symptoms. Anxiety is another common manifestation of postpartum depression. Sometimes moms who begin to experience anxiety aren't able to cope in the proper ways, so they begin feeling easily overwhelmed in certain situations, and that often leads to them having panic attacks. As soon as these panic attacks start, it's usually more common for them to continue to reoccur. Feeling easily overwhelmed can cause these panic attacks, high stimulus situations, things like that. One of the most important things to look out for is a mother having difficulty keeping relationships with her partner, friends and family, or even the baby. Oftentimes, mom will resent the baby or the partner. Mom and dad will sometimes start arguing. And this isn't just typical arguing, usually like arguing that is consistent, it doesn't stop, there's always an issue. This is mainly caused because of the constant mood swings that mom is going through right now. Sometimes mom will begin resenting the baby. She'll have trouble connecting to the baby. Even though the baby strives for that attention, it's not felt on the mother's end. She'll try pushing the baby away, won't want to spend time with baby or her family. She will isolate herself. Most moms have trouble doing performing activities that they used to enjoy because they don't enjoy anything anymore. For example, if a mother used to get up and go to the gym every day before going to work before pregnancy, now she will not have the motivation or the drive to go to the gym. She won't enjoy the things that she used to enjoy. Some moms even struggle with getting out of bed or just taking a shower or brushing their hair.
even little things like that are signs of postpartum depression. Many husbands or family members or friends don't look for these signs and symptoms, which is why many moms go so long without getting help because they don't see it themselves. And if they do see it, they think that it's supposed to be this way and that they're supposed to feel like this after childbirth when they're not. That's why it's so important for us to educate all moms, husbands, family members to look out for these things so that we don't have struggling moms who can't connect with their baby or can't connect with their partner and keep relationships that are healthy in their life. Crying is one of the most common physical things that we see in moms with postpartum depression. It's one of the most it's one of the easiest manifestations to look out for if you are in someone's life who is a new mom who has a newborn. Crying is the easiest thing for others to find, but some of the other manifestations are not so easy to catch, like the headaches, the sleepless nights, lack of focus. Those things are harder to catch. It takes a lot for the mom to notice those things, so it's important that we support new moms after their childbirth so that way they feel supported and can reach out to family members, friends, relatives, and us doctors and nurses for help if they're struggling with postpartum depression.
There can be a lot of risk factors or contributing factors to a mom having postpartum depression. Things such as hormonal changes with a rapid decline in estrogen and progesterone levels, individual socioeconomic factors, decreased social support system goes hand in hand with individual socioeconomic factors. If a mom doesn't have anybody to talk to or turn to ask for help or advice, it can take a toll on the mom. If the mom is having anxiety about her new role as a parent, especially if this was an unintended pregnancy, if she has a history of depressive disorder, or if the mom is experiencing low self-esteem. Another risk factor could be the mom and her partner or ex-partner had a history of violence or abuse. Also, medical conditions such as thyroid imbalance, diabetes, infertility, they play a role as well. Complications of breastfeeding, whether the mom is not producing milk, the baby isn't latching, it can really discourage a parent. And also, if the mom is a parent of multiples, twins, triplets, even if she has an older child, those all can play a role as well. Along with the manifestations of postpartum depression, there's also what is called as postpartum blues, which is really just a part of postpartum depression. The only difference is the time frame in which these symptoms occur. The most distinguishing factor is postpartum blues or baby blues normally subside after a few weeks, while postpartum depression can last up until a year or longer. Symptoms of postpartum blues can include feelings of sadness, a lack of appetite. You can have sleep pattern disturbances. The mom can have feelings of inadequacy, where she just feels like she's not good enough or she's not doing her job the way that she feels like she should be. The mom can just really cry out of nowhere for no apparent reason. She can have feelings of restlessness, insomnia, or fatigue. She can also have headaches. And the mom can also have anxiety. She can have bouts of anger. She can just feel sad. The most common physical finding that you will find is that the mom will just pretty much cry a lot.